Imagine walking into a clinic and finding out half the doctors just quit or have vanished. Sounds pretty wild, right? With AI stepping into healthcare, a lot of people are wondering if AI is about to replace doctors, and with all the stress and other regulatory issues happening in healthcare, if doctors are going to just flat out quit.
I am a doctor and I'm quitting medicine.
Over 40% of doctors regret their career choice.
I really just feel like a failure.
I'm a 33-year-old ENT surgeon and I'm leaving medicine for good.
I left my job as a primary care doctor after nearly 8 years of working for a big hospital system.
GPs in this country are set up to fail.
There's a lot of controversy around this.
The medical industry in the world has changed dramatically, and not in a good way for doctors and healthcare providers.
Don't do it.
Today we're diving into ChatGPT Health and OpenAI's new addition to the medical world to see what's really going on. If you've ever been to the doctor lately, you've seen that, appointment times have shrunk tremendously, where you're spending more time waiting than in the actual appointment, where it's, 5 minutes with the doctor, 10 minutes with the nurse, and then you're in and out 15 minutes flat. That's becoming an issue with healthcare, and it seems like AI is aiming to take its place. ChatGPT just released that they're having this new ChatGPT Health where you can actually talk to ChatGPT about your health information and can give you actually really good medical information about your individualized issue. You see in this example here where they show where you can ask it very basic questions. Can you give me a summary of my overall health? And it can tell a lot about you from what you already told it, whether it's from previous conversations or if that's something that you actually fed it, whether it's medical records or something else. And it can keep a running list of your overall health and then give it back to you on whether you are good or not. But it doesn't just stop there. This ChatGPT Health is a lot more secure than talking to ChatGPT regularly. And that's important because in this one, you can actually upload medical records and also upload different medical apps like your Apple Health, your MyFitnessPal, or even your Peloton information. So it'll be tracking your exercise level and different metrics about you, even maybe how much you sleep, how much you're walking, hydration level, all that good stuff that you may be tracking about yourself. You can be giving over to ChatGPT Health. And you may need this. With doctors seemingly having no time for patients, this would be good so you can take hold of your own type of health and research it in a safe, secure way. Not only that, let's say you did go to a doctor and a doctor was explaining that you have some type of issue or some type of deficiency or just some malnutrition issues. And sometimes what they're saying doesn't always come across smoothly. Well, ChatGPT Health has a way for you to take in the results, let's say blood work, some type of other results, or if you have even the diagnosis, you can upload that to the doctor, to the AI, and ChatGPT will give you the information back in layman terms. As long as you can go back and forth in way more detail than you could with the doctor, not because the doctor doesn't know, but just because the doctor may not have enough time with you. If you only spend 5 minutes with a doctor, that's a part of them explaining your results. That's a part of them going back and forth with you that 5 minutes may not be able to accommodate for. But now with AI, you can go in for days, hours, research different things and come back to it. And this is pretty good because they actually research with 200 plus doctors across 60 countries to research how effective this actually is. And not only that, they also had them review over 600,000 prompts and responses from AI to help train the AI on how to assist people with their medical information. And the best part about this is its security, because a lot of people already use ChatGPT for talking to it about their health stuff, whether it be mental health, physical health, or whatever type of health. They already talk to it, but it's not as secure as this one. This one is a secure place. It's encrypted and it's a one-stop shop where you can even house your files, and it keeps a running tally of your overall health to keep different things. And with AI, who knows? They may be trying to get more information from more people because maybe AI could see trends in health that other people can't see. Think about it. We've seen different food recalls, different health information that has issues from different cities, different states, or different communities that maybe had radiation, maybe had certain pollutants in their environment that isn't easily caught. But now with AI, different users in different cities and different regions can now be reporting on this, and AI could even then potentially find out that there's a common occurrence between everybody. But they did say that ChatGPT Health isn't here to replace your doctor, it's here to assist. But we all know that with AI, when it first came out, it was just supposed to assist you. And then now you hear that AI is firing people, laying people off, and now AI is trying to replace you. If you want to keep up with the latest and greatest AI news, should definitely like and subscribe. With that being said, your boy Dexter out.